that we're dealing with, Dr. Ari?
Yes, so firstly, thank you for having me on today. Whenever the weather becomes very cold or it starts to rain, like when we're in the hospital, we tend to see an increase, especially in the number of children and also very elderly people coming in with respiratory infections. And there are multiple theories as to why the rates of respiratory infections increase during the cold season. And what we have been seeing, especially where I work at the Karen Hospital, we've been seeing an increased number of people coming in with coughs, fevers, chest pains. And then when we do tests on them, the blood work shows us that most likely it's a viral infection. And most of the time, viral infections tend to be mild. But we've been seeing more increased cases of much more severe viral infections. Some of them we are able to manage with outpatient treatment, but there are some that require inpatient treatment, and sometimes some infections so severe that the patient needs to be in the ICU. Yes.
Now, for a very long time now, there have been reports, not only in Kenya, but globally, or with regard to there is a new strain of COVID. I mean, in terms of you as a doctor, do we have increased cases of a new variant of COVID?
So whenever somebody does come with the symptoms that would point us towards COVID, the issue with viruses is how rapidly they mutate. And so it is possible that they might be a new variant of COVID, but we haven't yet developed the technology in order to detect it. In terms of the regular variant of COVID that we've all gotten used to, whenever patients come and we do COVID tests, most of the time they're coming out negative. So if there is a new variant of COVID, we are yet to catch up with it, unfortunately.
Now, and even when we talk about the respiratory illnesses and them increasing, and as doctors you continue to see increases in these cases. Now, the question is, in terms of the populace, the public out there, what should they do? How should they take care of them just to be safe?
So prevention of respiratory illnesses is almost similar to prevention of even other diseases. One thing I cannot stress enough on is the importance of a very healthy diet that's rich in all the different macro and micronutrients, because that helps to maintain a strong immune system. And then I'm a very big advocate for exercise, be it cardiovascular exercise or resistance training, just any kind of activity that keeps the body moving. Yes. So when we then go beyond that, one thing which would be challenging with this cold season is that we'd have the tendency to close all our windows, close the doors so that we can keep warm. But the problem is that a closed environment is the perfect way to spread a respiratory illness, because the way respiratory illnesses are spread is mainly by coming in contact with what we call infected droplets. So if I cough, if I sneeze, I release aerosolized droplets into the atmosphere, which if another person inhales, then that's how they get infected, most of the time with most respiratory viruses. So another thing that would really go a long way with prevention is just what we call cough etiquette, per se. So if you're going to cough into your hand, cough into a handkerchief, then use hand sanitizer if you do cough into your hand, because the droplets on your hand are still infectious if you're to shake somebody else's hand and they were then to touch their face. Yes. Then in very vulnerable populations, this would be those who live with chronic diseases, as well as the elderly, so above the age of 65. The usage of masks, especially in public areas, would be advised, because when these infectious diseases hit the elderly, unfortunately it hits them very hard. So whatever we can do to try to prevent that would be in order. Yes.
And now, Doc, here's a question where for a very long time the public out there is, I have called over-the-counter or over-the-counter treatment, I'm good to go.
Yes.
And this has come, especially when it comes to antibiotics. And this has, research shows that this has continued to complicate the treatment of these diseases. So
Yes.
as a doctor, when I know that I have this cough that doesn't seem to be normal, how important is it for me to walk into a hospital and seek for professional advice as opposed to walking to a chemist and just buying a medicine that I was told by my friend would work?
So if you are very worried about the symptoms that you're having, if you're having a cough that you're coughing throughout the whole day, if you notice that you're starting to have difficulty in breathing, if while you're just seated, as unfortunately you're ill, if you hear some noises coming from your chest, these are all signs that the infection that you might have might be quite serious. And in that case, it would be wise to go to the hospital as compared to going to the local chemist to pick up some over-the-counter remedy. And what we're seeing because of this behavior of going and receiving over-the-counter either remedies, especially antibiotics that haven't been prescribed by doctors, is an increase in bacterial infections that are resistant to most of the antibiotics we use for simpler infections. Of course, which is very dangerous is the thing, because antibiotic-resistant infections usually are quite deadly. So by the widespread use of over-the-counter, well, okay, antibiotics usually aren't over-the-counter, but by buying certain antibiotics without knowing if it's a viral or bacterial infection that requires antibiotics, we increase the rates of antibiotic resistance. And the thing is, most essentially colds that people get, sore throats, coughs, runny noses, etc., those are mainly caused by viruses. And most of the time, most viral infections are what we call self-limiting, such that with some supportive treatment, maybe some antihistamine, some paracetamol for the fever, your body's natural defenses will deal with the virus. And with some rest, it will go. Yes.
Now, Dr. Now there is also the conversation on, especially since COVID came through, there is, I have a cold, chai dawa is the way to go, you know, and for a very long time, now since COVID came, that is the way everybody goes. Like even our restaurants nowadays, chai dawa is on the menu, like it's something that does exist there. While it is important for us to continue taking all this because of the vitamins that do exist in them, just how important is it for us to just go a step further and just ask for advice and help from the doctors? Because chai dawa does not deal with these complex situations. Because I know there are those who, with these cold season, chai dawa is the way to go. But it does not solve the problem. So what's your advice to those who love chai dawas? I love chai dawa.
If your symptoms are very mild, then I think it's okay to take it, because the interesting thing about most medications is they're derived from a lot of herbs, and things like ginger, for example, contains a lot of sulfur-containing compounds that are naturally antibiotic. So the chai dawas and everything, if it's mild, it's okay. But now, if it starts to get more serious, if you're not able to get out of bed, you're not able to attend to any of your daily activities, then I think it would probably be time to put down the chai dawa and then go to the hospital.
And go for the real dawa.
yes.
So sorry, Dr. And now, perhaps with this cold weather that we're experiencing right now, I mean, it contributes to the same, and we cannot belabor enough the need for people to just stay warm. I mean, dress up in a way that you're able to protect yourself from the elements. I mean, as someone who you are with the medical fraternity, people who say, you know, I gym, I do all these things, I'm easy, my body is always ready. I mean, what is your advice to such kind of people who are freezing and shining?
It really depends on how severe whatever it is that they're going through actually is. Exercise is something which does strengthen the immunity. So But then again, if you're really facing some severe symptoms, it doesn't matter how strong you are, how big your muscles are. If you have something like pneumonia or influenza or something like that, then regardless of what it is that you do at the gym or how long you run for, that's something which will land you in the hospital. So one thing I'd really just encourage, unfortunately us men, we have what's called very poor health-seeking behavior. In the sense that when we have something that's going on, we'd rather just, just tough it out. Real men don't go to the hospital. No, that's nonsense. It's very important at all times, if you're worried about your health, to visit your local healthcare provider and seek the assistance that you require. Yes. And at the Karen Hospital, I mean, our doors are always open at all times. We operate 24 hours a day. So, yeah, it's just very important to take our health very seriously. When they say you only live once, I mean, that is the truth. Yeah, we only have this one life. Yes, so
and Dr. you've mentioned, you've just brought up something that is critical. Now that is the pneumonia cases that continue to be reported.
Yes.
I mean, why does it seem to, we're continuously having increased numbers of pneumonia cases? Why is that the case?
So, one thing which might be happening, frequent respiratory infections are actually a sign, or can be a sign, of lowered immunity. And interestingly enough, one of the causes of a lowered immunity is malnutrition. Malnutrition in the sense that we're not getting the vitamins and minerals at their required daily doses that we need for our immune systems to work optimally. Yes, and so as a result of that, it makes getting infections more common, and then the more infections you get, the more likely you are to get a much more serious infection. And then, of course, there are certain populations who already have certain respiratory diseases. So one thing which we'll see at the hospital is a rise in the number of what we call acute asthma exacerbations, where people who already have asthma, they start getting asthma attacks. And that's literally because the cold can actually be a trigger for some people's asthma. Yes.
Yeah. And now, Dr. as we continue to have this discussion now, someone would want to know, in terms of preventative, what are some of, say, the meals or foods that goes into helping boost the immunity?
I'd really have to say,
or supplements that do exist.
So one of the supplements which really do help or does help is vitamin C. Vitamin C as well as vitamin D, I believe, yes. And then certain antioxidants, which you find especially in things like fruit as well as also vegetables, in the right amounts are very helpful for your immunity. So overall, what I'd really just say is a well-balanced diet. Like in every portion of food that you eat, for there to be some vegetables, afterwards to have some fruit, and that, for the most part, will cover what you need on a daily basis to keep you healthy. Yeah.
Dr. Tayo Opakunle, doctor at Karen Hospital and also a respiratory expert, as we talk about issues to do with how best we are able to deal with respiratory illnesses that we continue to experience. Even if you gym, always remember to